Hi, everybody. Welcome back. 2022, our first Monica Makes It Happen live Facebook show of 2022. And as it is about Omicron all the time, we want to do your questions, your burning questions, rapid fire with a doctor right now. So, what I want you to do is if you have any questions, make sure to put them in right now. Talk to us. We are live with Dr. Syra Madad is joining us. Thank you so much, doctor, for being here. She's an infectious disease epidemiologist, and we're going to answer 11 questions rapid fire about, well, we got them from Instagram, Twitter, Facebook. So we're going to answer them as we go. But first, let's listen to Dan Manarino and Hazel Sanchez. They spoke to the health commissioner this morning and have the very latest.
Well, getting back to the numbers, the daily positivity and hospitalization rates for New York City, it's really alarming. More than 5,000 New Yorkers were admitted to hospitals just on Tuesday, and that's the highest dating back to May of 2020. So how high are you expecting those numbers to go, especially given the fact that we're also at the peak of the flu season?
Yes, we are seeing unprecedented numbers with respect to cases and percent positivity. Our hospitalization numbers have increased in recent days and weeks. There are about 5,700 patients who are currently hospitalized in New York City. To put that into context, that's still less than half of the number of COVID patients that were hospitalized during spring of 2020, but is still a very significant number. I do expect particularly the number hospitalized to continue going up for the coming days and perhaps weeks. And this is why it's so important for everyone to take the steps that we can right now to support healthcare workers. Get your booster shot if you haven't yet. Vaccinate your child. Get tested, wear a mask, and optimally a high quality mask, and do the other things that we know can help to curb the spread.
Wow, thank you, Dan and Hazel. I hope you're watching our morning show every morning. They get the big gets, especially the health commissioner. And we have a big get tonight. Of course, Dr. Syra Madad. She is an infectious disease epidemiologist from New York City Health and Hospitals. We're so grateful to have you with us. It's so great to have a doctor live. And so many of you are taking our suggestions, asking a question. Hi, Carmen Rodriguez. Hi, Greg. Hi, Sophia, everybody. Already asking questions, which is great. The statistic is alarming, doctor. New York City has reported more than 36,000 cases of coronavirus over the last 7-day period, which has hospitals operating at their near capacity. Our first question, 11 questions, rapid fire. What is unusual about the Omicron variant, and how does it differentiate from various variants such as Delta?
Omicron is much more transmissible than any variant that we have seen. So when we compare it to Delta, which was the dominant variant over the summer up until Omicron has taken over, you're seeing that the Omicron is about 2 to 3 times more contagious than the Delta variant. But luckily, when we look at causing more severe illness, it's causing more mild illness compared to Delta, but it's also important to, point out that a variant like Omicron that is twice as contagious but less virulent can still cause the same amount of havoc on our hospitalizations, and that's exactly what is happening. And so they're essentially canceling each other out. So you're seeing a very high number of cases, but you're also seeing high numbers of hospitalization because there's so much virus in the community.
So disturbing. And Crystal, I love you back. She's watching on Facebook. Does the COVID vaccine protect against Omicron?
Absolutely. The COVID-19 vaccines are holding up beautifully. In fact, if you're looking at who's being hospitalized by vaccination status, you're seeing by and large, majority of those that are requiring hospitalization and ICU level care are those that are unvaccinated or partially vaccinated. And those that are fully vaccinated or those that are, mainly over the age of 60, have comorbidities or underlying health conditions. And so it really just shows you the testament that these COVID-19 vaccines are holding up really, really well.
And Tanya's making sure to mention vaccinate, and they have trilingual vaccination vans out in certain communities. That's on our website at pix11.com if you want to check that out. Again, what is the difference in symptoms?
So when we look at the Omicron variant, what you're seeing is much more kind of upper respiratory signs and symptoms like, runny nose, cough, sore throat. And so when you have those types of symptoms, that can be very nonspecific. You may think you have the flu or the cold. So the best way to tell whether you have the flu, the cold, or the COVID-19, the virus that causes COVID-19, is to get tested. But importantly, is to make sure that you're isolating from other people, because you don't want to transmit any of these viruses to anybody, again, whether it's flu or whether it's COVID.
Now, if you had COVID already, what are the chances of getting COVID again?
So it really depends on your vaccination status. So for example, for those that are not vaccinated, they have a very high risk of getting the Omicron variant because it's much more transmissible. If you had history of prior infections, so maybe you got infected with Delta variant and you were not vaccinated, the risk of reinfection is anywhere from 5 to 8 times. So that's a really real risk. If you are vaccinated, your risk of contracting Omicron is less than those that are unvaccinated. But because there's so much virus in the community, you may be exposed to the virus, you may experience a breakthrough case. And for those that experience a breakthrough infection, they may be asymptomatic, or they may have a mild case, or they may have something a little bit more severe, but luckily it's keeping them out of the hospital. So again, hospital vaccinations are holding up really well.
We are getting so many comments. Erica, Bridget, Tiffany, Alex, all of you. We have great questions coming up. But Flu-Rona, I heard about something called Flu-Rona. What is that, and what does that mean?
Yeah, it's not a real term. I think the media just made it up, to be very honest. I think it's something cute that they thought would kind of put 2 and 2 together, but it's not a real term. And essentially what they're trying to get at is the co-infection. If you get co-infected with COVID-19 and flu at the same time, that can happen, especially right now when both of these viruses are circulating in our community. And so it's really important that you get vaccinated against COVID-19, and then you also get vaccinated against flu. For those that are over 6 months, you are eligible to get vaccinated against the flu. And then for those that are over the age of 5, you're eligible to get vaccinated against COVID-19.
Christine, thank you for watching. She said, I just got diagnosed, been sick 8 days, took Tamiflu. How do I get better?
So if you have influenza virus, Tamiflu is great. And that's what really helps kind of reduce your symptoms and kind of the amount of time that you're sick. So it just depends on what virus that you have. But I would say rest. If you have any additional concerns, or if your symptoms get worse, certainly reach out to your healthcare provider, or go to New York City Health and Hospitals. It's a really great healthcare system to seek healthcare services.
Now, I have to say, we love our Instagram audience as well. Experts have suggested waiting 3 to 5 days. Things have changed so much throughout the days after exposure to COVID to test for the virus. But many people are wondering, how do you know if you've been exposed if you have no symptoms?
Yeah, and this is where just testing routinely is really important. And these at-home rapid antigen tests are a really great kind of at-home or community surveillance system. So if you want to get tested on an ongoing basis, it's a great way to see whether you are currently infected, whether you're contagious, and you can spread it to other people. So go ahead and pick up an at-home test near you.
That's right. And Dee Perez is saying, what is considered high quality masks? I have this question myself. Some people I see wearing 2 masks. Is that a good idea?
Yeah, so high quality mask, it really depends. I would say the 2 F's are really important: fit and filtration. So when we look at high quality masks, these N95 respirators, these KN95s, the KF94s, those are really great masks that help filter out more particles in the air. And so if you are not able to get some of those high quality masks, and they are, pretty widely available, but they may be more expensive. Double masking, which includes wearing a surgical mask and a cloth mask, that's what's going to help, because it helps. That surgical mask will help with the filtration, and that cloth mask on top will help with that fit. So it gives you that good seal.
And no flaws. That was such a great question. No flaws. I hope you're watching still. Talk about testing. What is the best way to get tested? So many at-home tests. Are those effective? What's going on with our testing?
So rapid at-home tests play a really big role, and they're still really important, in our community today. PCR tests certainly play a role. So the big question is, what are you testing for? So if you're in a hospital, if you want to know if your symptoms, if you're symptomatic and you want to get tested, PCR is great. If you're going to go visit grandma, go to a gathering, doing that rapid at-home test is also really great. But what's really important about the rapid at-home test is there's a reason why the test kits come in 2 tests. It's for you to get tested twice over an interval of 24 to 48 hours. So get yourself tested the first time with the rapid at-home test, and then take that second test in that kit and test yourself about 24, 48, or 72 hours afterwards to see if you're infected and contagious, to spread the virus.
Going back to vaccinations, Olga is watching us right now. She says she got 3 vaccinations on the same arm and she cannot move her arm. That happened to me too, where you have that weak arm. How long does that soreness last usually?
It should be, a very short period of time, but if it persists, I would certainly say, contact a healthcare provider. It's usually best when you get, multiple vaccines to try to, get it in different parts of the arm or a different arm. And obviously she got three vaccines at different times. So, it's not unusual.
Yeah, and Olga, it lasted for me for 2 days. So I had to take, and luckily I did it on a Friday night. So then my weekend was destroyed, but whatever. At least I'm safe. What can people do to protect themselves? That is the biggest question that we get on Instagram, Facebook, and Twitter.
The number 1, number 2, and number 3 best way to protect yourself is to get, fully vaccinated and up to date with your COVID-19 vaccines. So completing your primary series, as well as getting a booster dose if you're eligible. In addition to that, it's not just a vaccine only approach. Continue to wear a mask in indoor settings and mixed gatherings. Make sure you seek ventilated spaces. Test yourself often, or if you're going into a large gathering, making sure that people are tested. Those are some really simple and easy ways to help protect yourself.
Wow, and Olga's saying it's been months where it's been sore like that. Wow. Olga has quite that's a lengthy soreness there. But back to testing again. Can you test positive for 2 variants at once?
That's a great question. It can theoretically can happen, but we haven't really seen any cases like that. But what I would say is whether, if you're infected with the virus that causes COVID-19, is to make sure that you're monitoring your signs and symptoms. And if they become worrisome, or if you have shortness of breath or confusion, or your skin color, on your lips change, make sure that you seek healthcare services right away.
Now, since you're saying, at this point, Omicron is less, or it's more contagious, does that mean we're going to reach herd immunity quicker?
So the Omicron variant is certainly going to add much more immunity in our population, preferably through vaccination. When people see there's much more virus circulating in the community, those that are unvaccinated, hopefully that will give them a motivation to get vaccinated. But certainly you're seeing a lot more infections as well. So it is going to provide a much more immunity in our population. So when the next variant comes, we'll be better guarded in that sense.
Okay, rapid fire number 11 question: rapid or PCR test? Which one?
So they both play really important roles, and it really just depends on the purpose, right? So if you're being hospitalized or if you are symptomatic, PCR is the golden standard. Rapid at-home test is really great if you're going to go ahead and visit somebody and you want to know in that moment, am I contagious and can I spread it to others? So they both play a really important role. So I would say, get whichever one that's easiest for you.
Elle is joining us. So many people have questions.
Yeah, so many comments on social media. I've been monitoring the comments. So I've got 3 for you today, Dr. Madad. First one is from John Wolf, who says, can you have long hauler symptoms if you are vaccinated?
So we do have studies, and as well as kind of real world case studies that have shown that if you are fully vaccinated, your risk of experiencing long COVID is basically less than half, but it can happen. And unfortunately, that is the reality, but, can it cause less of a kind of a severe outcome in that sense? Being vaccinated does help, provide that benefit.
Absolutely. Now, Paula says, my husband just tested positive last week. He's vaccinated and has a booster. Do you think he's still going to be contagious 2 weeks after testing positive?
No, so CDC guidance has mentioned that, if even if you're fully vaccinated, to isolate for 5 days. And then if you need to go out in public, to go ahead and wear that high quality mask for another 5 days. Now, the best way to also ensure that you are not actively infected and shedding the virus is to get tested. And so that rapid at-home test would be a really great layer of assurance that you are not currently infected with the virus.
And last one from our social media platforms. Thank you to everyone who's been commenting the entire time. This one comes from Roslyn, who asks about your thoughts on a second booster. Do you think that there's going to be a likelihood of us getting a second booster soon?
So, right now we're still learning a lot about this virus. Science is evolving quite fast. We're living through obviously a pandemic. And so I wouldn't say it's out of the question. You're seeing Israel, administer fourth doses to high-risk individuals, healthcare workers. It really just depends on what our goals are, as well as what the situation looks like. So right now we know the third dose, or that booster dose, is really providing some really great prevention against infection and re-stimulating your immune system and providing that good protection against severe outcomes. It's yet to be seen whether a fourth dose is needed.
And, I think we're learning as we go, which is so great, Doctor. You were so helpful. And Michelle, I have to correct myself. Michelle is correcting me. She said, I said, at least I'm safe once I'm vaccinated. I'm doing everything I can. But again, you're not completely safe from this virus. So you have to always be on guard and do your best. And it's always washing your hands, wearing your mask, staying socially distant, and of course, listening to doctors like you and your wonderful advice. Thank you so much for being with us tonight. And all of your questions were fantastic. We're going to have a lot more information, of course, on our website, pix11.com, as always, and all of our social media platforms. Thanks for all your questions, especially on Instagram, Facebook, and Twitter. Thanks, guys. And Doctor, I hope to have you back. We're going to have you back for this rapid fire yet again. 11 of your top questions. Always watch Pix 11 News at 4, 5, 6, and 10. And of course, our fantastic morning show. Dan and Hazel will probably have the health commissioner back on again. Doctor, thanks again. And everyone stay safe. Good night.